Hello friends, today we're going to discuss about long-acting injectable antipsychotics, also called as depot antipsychotics. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about long-acting injectable antipsychotics, first generation depot preparations, second generation depot preparation, how do this first generation and second generation depot preparations differ, how do these parenteral medications differ with regard to oral medications in effectiveness, and also what are the side effects. Before we discuss about long-acting injectables, we need to understand about chronic mental disorders. The first is schizophrenia. Schizophrenia is a chronic mental disorder. Approximately 30 to 35% do not respond to antipsychotics. Those who respond also relapse because of poor drug adherence. That means they stop medication. Because of this poor compliance, there will be relapse and hence poor course and outcome. If you look at the course of schizophrenia, invariably after the prodrome, you can see there is acute psychotic episode. As soon as the treatment is started, the symptoms remit. Unfortunately, the patient will stop medication, or else drug abuse, substance use, and stress causes relapse. If you look at the rate of relapse, in a first episode psychotic patient, within 5 years, the cumulative relapse rate is up to 81.9%. The main reason being is again drug default or poor compliance of medication. If you look at the first year relapse rate in a systematic review done by Lichett in 2012, clearly indicated that if a person stopped antipsychotics, the relapse rate was 64%, and if they continued medication, the relapse rate was 27%. Here it clearly indicated continuing medication prevented relapse. Unfortunately, this poor drug compliance causes multiple relapse. So now the question is, if there is a relapse, what will happen? In this diagram, it clearly see that persistence of psychotic symptoms increases as the number of episode increases. On the y-axis, you can see the persistence of psychotic symptoms. In the first episode, only 13% have psychotic symptoms. In the second episode, 7%. In the third episode, 17%. And in the fourth episode, 27%. That means as the relapse increases, the chronicity and also the persistence of psychotic symptoms increases, and eventually they become drug resistant. Hence, low adherence to oral antipsychotic treatment negatively influences the course and outcome by causing multiple relapse. And these relapse leads to poor functionality and social outcome and also treatment resistance. Along with this, many psychotic patients become violent, aggressive, and they get involved in legal battle, or else you can call it as persons with mental illness in legal conflict. In such a scenario, the court may order for mandatory treatment. Many a time, administering oral medication is a big challenge for a person with mental illness in legal conflict. In such a scenario, invariably, long-acting injectables plays a crucial role. That is about schizophrenia. Let's discuss about bipolar disorder. Bipolar disorder is also a chronic and persistent mental illness and one of the leading cause of disability. The mainstay of treatment in bipolar disorder is mood stabilizers and second generation antipsychotics. If you look at the studies of bipolar, major reason for relapse is drug default. Invariably, majority of the patient relapse in the first year. The major determinant of poor outcome in bipolar disorder is non-adherence to the medication or else partial adherence to the medication. Estimated reason for the poor outcome is relapse. Up to 10 to 60% of the patient do not take medications regularly. Now let's understand how depot preparations help in managing these chronic conditions. So let's classify long-acting injectable antipsychotics. At present, there are 13 long-acting injectables antipsychotics are available in the market. 7 of them are first generation antipsychotics. 6 are second generation antipsychotics. These are the medications either approved in US or in European markets. Let's discuss both first generation and second generation depot preparation. With regard to first generation long-acting injectable antipsychotics, the drugs which are available in India are fluphenazine deconate, flufenthixol deconate, haloperidol deconate, and zuclofenthiazole deconate. Some of the first generation drugs which are not available in India is bromoperidol deconate, perfenazine deconate, and piperacillin palmitates are not available in India. Most of the first generation long-acting antipsychotics are deconates. A long-acting drug such as fluphenazine or else zuclofenthiazole are converted into deconate by esterification of these drugs with deconic acid. This deconate with the first generation antipsychotics is a prodrug. This prodrug, when it is injected, it is released slowly. When it is released slowly, the esterification should occur and the hydrolysis of these medication releases the active drug which acts on the brain. This deconates releases very slowly into the bloodstream. Hence, these medications are given once in 15 days or once a month. What are the side effects of first generation long-acting injectables? The commonest is prolactin elevation, weight gain, akathisia, Parkinsonism, anticholinergic side effects, sedation, hypotension, and NMS. Now let's discuss about second generation depot preparations. The medications which are available in India are risperidone microspheres, olanzapine palmitate, paliperidone palmitate. The drugs which are not available in India is aripiprazole long-acting, that is monohydrate, and Loraxel. However, there is a risperidone subcutaneous extended release is available in the international market, not yet available in India. The drugs which are available in India is risperidone microspheres, which are available in 25 mg, 37.5, and 50 mg. With regard to olanzapine palmitate, 210, 300, and 405 mg depot preparations are available. With regard to paliperidone palmitate, 1 month drug is available. Here, it is given either as a 25 mg, 50 mg, 100 mg, and 150 mg are available. 3-month paliperidone palmitate or 6-month formulation is not yet marketed in India. The side effects of second generation depot preparations are weight gain, hyperlipidemia, glucose intolerance, Parkinsonism, sedation, hypotension, and pain at the site of injection. Now let's understand the pharmacokinetics of long-acting injectables antipsychotics. Pharmacokinetics means it is defined as the characteristics of drug absorption, distribution, metabolism, and elimination from the body. Here in long-acting injectable antipsychotics, absorption refers to the transfer of this drug from the administration site to the systemic circulation. That means the absorption rates differ from oral medication to injectable medication. Oral is as soon as it is taken, the absorption starts. Whereas for long-acting injectables, once it is given, the hydrolysis occurs slowly and it is slowly released. LA antipsychotics are injected either intramuscularly or subcutaneously. Once these prodrugs are introduced into the body, they are slowly absorbed from the injection site into the circulation. Once the drug is absorbed from the injection site into the bloodstream, the distribution and elimination of these drugs starts slowly. But however, with regard to oral medication, as soon as they take, the absorption and elimination starts. Absorption from the injection site can be influenced by various factors. The drug factor. Here, what is the water solubility of the medication? What is the preparation? What is the delivery vehicle? Is it a microsphere? Is it a deconate? Is it palmitate? Palmate? Based upon the research, how the molecule is used as a agent which is transferable through a deconates or various method depends upon how the drug is delivered. The patient factors also play a role, such as body weight, subcutaneous fat, IM or else whether it is subcutaneous injection, site of the injection where it is given, and vascularity of the site of injection all play a role. For most of the long-acting preparation, large percent of the injected product initially remains in the injected area. The absorption rate of the long-acting injectable antipsychotics is slower than the elimination rate, resulting in flip-flop kinetics, where the time to steady state is a function of absorption and the concentration of a constant state is the function of elimination. Here, please remember, in long-acting antipsychotics, the constant rate depends upon the absorption rate. This diagram clearly indicates about the flip-flop kinetics of long-acting injectables. On the one side, you can see oral formulation. On the other side, you can see long-acting injectable formulation. Especially in oral formulation, the plasma blood concentration level, which is indicated by blue arrow, is directly dependent upon the elimination rate of the drug, which is indicated by green. Whereas in long-acting injectable antipsychotics, the plasma concentration is directly dependent upon the absorption rates. In oral antipsychotics, it is the elimination from the body dictates plasma concentration, whereas in long-acting injectable, it is the absorption rate from the site indicates the plasma or the blood concentration. Since there is a difference in oral and parenteral with regard to elimination, one is from the elimination rate, whereas in injectables, it is absorption rate. Hence, the flip-flop kinetics of LAI. The absorption rate controls the time of steady state in injectables. Hence, the preparation, whether it is a deconate, whether it is a microsphere, whether it is a palmitate, based upon that concentration of the blood level depends. 90% steady state is reached in 3.3 half-lives, especially in injectables. The apparent half-life reflects that long-acting injectables exhibits a prolonged and a gradual absorption from the injection site, which drives the extended duration of blood concentration. These long-acting injectables avoid first-pass metabolism in the liver, which increases the bioavailability, and also the requirement of dosage is decreased when compared to oral dosage. Hence, theoretically, the side effect should be less. If you see the oral medications versus long-acting injectables, whenever the patient takes oral medication, you can see suddenly there is an increase in the blood level, and when he has to take the next dosage, there is a trough level. That means there is a rapid fluctuation when the patient takes oral medication. Whereas in a depot preparation, there will be a constant serum level will be maintained. That means the fluctuation is very less and the side effect occurrence also will be less theoretically. If you look at this, the slow and steady absorption from the site of the injection, avoiding first pass metabolism, and hence the peaks and trough will be very less in injectables when compared to oral. Hence, the side effects should be less. Summarizing long-acting injectables. Invariably, on comparison with oral antipsychotics, the long-acting injectable causes stable blood concentration, consistent bioavailability, predictable medication adherence. You are sure that you have given an injection, and an improved pharmacokinetic profile because the absorption rate indicates the serum level. All of this indicates that injectable requirement is less when compared to oral medication dosage. Now let's understand whether these long-acting injectables has a larger role to play from the public health perspective. In this regard, a study was published in Therapeutic Advances in Psychopharmacology by Stipp and Lashin in 2018. The title of the study is Real-World Effectiveness of Long-Acting Antipsychotic Treatment in a Nationwide Cohort of 3,957 patients with schizophrenia, schizoaffective disorder, and other diagnoses in Quebec. Quebec is a city in Canada. The objective of the study was focused on evaluating the impact of early initiation of long-acting antipsychotics medication on healthcare resource utilization. That means whether these long-acting injectables played any role in public health resource utilization. The results were stunning. The number of hospitalization when long-acting injectables were initiated early, it was reduced to half. That means a significant amount of resources and money was saved. The number of hospitalization days was reduced to 31.5 days for first generation depot preparations, whereas 38.8 days was reduced in second generation depot preparations. The total healthcare cost saving for all users was 29,876 Canadian dollar per patient per year was saved. The cost saving with regard to first generation antipsychotics depot preparation, the save Canadian dollar was 31,924. Whereas with regard to second generation depot preparations, Canadian dollar saved was $39,100. This study clearly indicated long-acting injectable antipsychotics played a crucial role in public health expenditure and resource utilization. Now let's look into how this public health money was saved. In this regard, there is a study with regard to adherence and persistence on treatment. Again, an important research article published by Lee and Swartz in 2021 in Psychiatric Research. This is a review article titled as Adherence and Persistence to Long-Acting Injectables with regard to dopamine receptor blocking agent therapy in United States, a systemic review and a meta-analysis of cohort studies. This systemic review and meta-analysis looked into the adherence and persistence to long-acting injectables in the United States. What do you mean by adherence rate? As per this study, proportion of days covered for more than or equal to 80% then means the person is adherent to medication. What do you mean by persistence rate? No gap in therapy for more than or equal to 60 days for long-acting injectables. This review and meta-analysis included 26 articles for qualitative review and 8 articles for quantitative review. Let's look into the results. The use of long-acting injectables antipsychotics showed the cumulative benefit of achieving adherence 1.40 times higher than the oral antipsychotics. The cumulative benefit of being persistently on the therapy was 1.56 times higher in long-acting injectables when compared to oral antipsychotics. This study clearly demonstrated long-acting injectables confers benefit in adherence and persistence on medication when compared to oral antipsychotics. When long-acting injectables were compared to oral antipsychotics, how do they differ? In this regard, Park and his colleagues did a study titled as Comparative Efficacy and Safety of Long-Acting Injectable and Oral Second-Generation Antipsychotics for the Treatment of Schizophrenia. This was a systematic review and meta-analysis published in 2018 in a journal called as Clinical Psychopharmacology and Neuroscience. This meta-analysis included 30 studies, in that 17 were RCTs and 13 were observational studies. This meta-analysis concluded that long-acting injectables, especially from second generation, was characterized by significantly lower rate of relapse, longer time to take relapse, and fewer hospital stay when compared to oral second generation antipsychotics. This meta-analysis indicated long-acting second generation antipsychotics scored over the oral medications. But however, the group treated with long-acting injectables had significantly higher rate of extrapyramidal symptoms and prolactin-related symptoms when compared to oral medications. Although long-acting injectable second-generation antipsychotics were effective in many domains, but these side effects may play a crucial role in deciding whether to give oral or long-acting injectables. Similarly, another study done by Lian and his colleagues in 2021 in the journal Early Intervention in Psychiatry was published. The title of the study was Efficacy of Long-Acting Injectable versus Oral Antipsychotic Drug in Early Psychosis, a systematic review and meta-analysis. This meta-analysis included 15 studies comprising of 10,584 participants. In this, 7 were RCTs, 7 were observational studies, and 1 was post-hoc analysis. This study indicated that long-acting injectables may provide benefit over oral antipsychotics with respect to reducing the relapse and hospitalization rate in early psychosis patients. And there was another important largest long-acting injectable meta-analysis study was published in Lancet of Psychiatry. This study was done by Kishimoto and his colleagues, and the title of the study was Long-Acting Injectable versus Oral Antipsychotics for the maintenance treatment of schizophrenia, a systematic review, and a comparative meta-analysis of randomized cohort and pre-post studies. This is one of the largest study which is published at this point of time. The authors of this study reviewed 137 studies, which comprised of 397,319 patients were part of the study. In this meta-analysis, 32 RCTs, 65 cohort studies, 40 pre-post studies. And this was the biggest meta-analysis at this point of time. The authors concluded that they found consistently significant benefits were noted in long-acting injectables when compared to oral antipsychotics in preventing relapse and hospitalization. Further, authors also concluded by using long-acting injectables, we can improve the outcome of schizophrenia. This was a significant statement made by the authors. Suppose if you switch oral antipsychotics to long-acting injectables in the same patient, whether this relapse rate and hospitalization remains same or not. In this regard, a Kishimoto et al. And his colleagues did a study in 2013 and published in JCP. Here, in this study, a result of meta-analysis of 25 mirror image studies comprising of 5,940 participants, in which 23 of the 25 studies individual showed long-acting injectable superiority for reducing hospitalization in the same individuals switching from oral antipsychotics to long-acting injection. This was one of the study which clearly said if the patients who are on oral antipsychotics, look at their hospital rate and relapse rate, switch over them to long-acting injectables and observe them over a period of 1 to 2 years. You can see that in the same individuals, the admission rate and relapse rate significantly reduced when they were on long-acting injectables and compared to oral injectables. There were studies which looked into first generation versus second generation long-acting injectables. Uraib et al. In 2020 published an article in Journal of Psychiatric Research. The title of the study was Preliminary Efficacy and Tolerability Profile of First versus Second Generation Long-Acting Injectables Antipsychotics in Schizophrenia, a systematic review and meta-analysis. This systematic review and meta-analysis was to study the efficacy and safety of first generation antipsychotic versus second generation antipsychotic long injectables in schizophrenia patient. This meta-analysis included review, especially qualitative studies where n is equal to 17 and quantitative studies were 3. This study clearly indicated second generation long-acting injectables were similar to first generation in terms of effectiveness on PANSS. That means there were no difference between first generation and second generation long-acting injectables. Further, second generation long-acting injectables reduce the risk of having anti-Parkinsonism drugs, whereas first generation long-acting injectables required anti-Parkinson drugs. Second generation long-acting injectables significantly increased the side effects such as increase in serum prolactin level, weight gain, and body mass index. Further, for long-term management, depot preparation of paliperidone, haloperidol, risperidone, and flufenazine were equally effective in symptom control, adherence, with significant difference in safety profile. This study concluded the first generation and second generation antipsychotics were similar in effectiveness and also admission and relapse rate, but however, they differed in side effect profile. Similarly, there was one more study with regard to long-acting injectables in early psychosis. Again, Lian et al. Did a study and published in 2022. The title of the study was Long-Acting Injectable Antipsychotics for Early Psychosis, a comprehensive systematic review. In this systematic review, 33 studies were included, 8 were RCTs, 4 were postdocs, 2 case reports, and 19 naturalistic studies. All these studies looked into various antipsychotics. Majority of the studies were on risperidone long-acting. 10 studies were with regard to paliperidone palmate. 3 studies with regard to flofenazine deconate. 2 studies with regard to flofenthexol deconate, and 1 was regarding aripiprazole. The present systematic review supported that long-acting injectables are clinically effective, improves medication adherence, decreases hospitalization and relapse. The present finding indicated that long-acting injectables are of relatively safe and effective treatment, although the majority of the evidence is based on risperidone and paliperidone studies. Similarly, long-acting injectables were looked into mood disorder also. Pacioretty et al. Published a study in 2019 titled Long-Acting Injectable Antipsychotics for Maintenance Treatment of Bipolar and Schizoaffective Disorder, a systematic review. This article was published in European Neuropsychopharmacology in 2019. In this review, 15 studies were included. 6 were double-blind and 9 were open studies. 13 studies looked into bipolar and 2 studies looked into schizoaffective disorder. Let's look into the results. Dippo-neuroleptics prevented manic episodes but did not prevent recurrence of depression. Many of the studies also said that long-acting injectable may worsen depressive symptoms. However, the meta-analysis also concluded the aripiprazole monohydrate significantly delayed the time of recurrence of manic episode without inducing depressive episode. That means aripiprazole long-acting had an edge over other medication with regard to worsening depressive symptoms. This study concluded long-actings injectables are effective and well-tolerated maintenance treatment for bipolar disorder and schizoaffective disorder. Similarly, second-generation long-acting injectables were studied in bipolar disorder. Kermatin and his colleagues did a study with regard to systematic review of long-acting injectable second generation for management of bipolar. This study was published in CNS Drug Journal in 2019. Author reviewed various types of study, such as controlled studies, observational studies, case series, and case reports. This was almost like a study which looked into different types. In that 37 studies met the criteria, and most of the studies reviewed long-acting risperidone, aripiprazole, paliperidone, and olanzapine in patients with bipolar. The results indicated second-generation long-acting antipsychotics, particularly risperidone and aripiprazole, were safe and effective alternative for oral medications in managing bipolar disorder. Further, the study also concluded there is some preliminary evidence that clinicians should consider second-generation long-acting antipsychotics for those patients who do not respond adequately on oral medication, or if the patient is experiencing rapid cycling, then long-acting injectables can be considered. If you look at the second-generation long-acting injectables, Wang and his colleagues published a study in Schizophrenia Bulletin titled as Long-Acting Injectable Second-Generation Antipsychotics versus Placebo and Their Oral Formulation in Acute Schizophrenia, a systematic review and a meta-analysis of RCTs. This study was published recently in 2023. This was the first systematic review that compared efficacy and safety of second generation antipsychotics versus placebo and other oral counterparts of antipsychotics in treatment of acute schizophrenia. The report of this study was based on 66 studies comprising of 14,988 participants. In this study, they clearly said that second generation long-acting injectables were more effective than placebo and generally as equally effective as oral antipsychotics. However, certain side effects occurred less frequently in long-acting injectables when compared to oral antipsychotics. Now the question comes is whether these long-acting injectables can be used in children and adolescent population. In this regard, Beza and his colleagues did a study and published in 2023. The title of the study was What Role for Long-Acting Injectable Antipsychotics in Managing Schizophrenia Spectrum Disorders in Children and Adolescent, a systematic review published in Pediatric Drugs Journal. The results said that there are few studies assessing the use of long-acting injectables in adolescents. Hence, generalizing of these findings are difficult. However, preliminary evidence suggests that long-acting injectables, especially in adolescents, are effective, safe, and tolerated well. However, there were no studies examining the use of long-acting injectables in children, that is, less than 12 years old. Hence, you have to be very careful in prescribing medication in children and also in adolescents. If you look at the advantage and disadvantage of long-acting injectables, the benefits of long-acting injectable are it improves compliance, reduces the risk of relapse, hence hospitalization, improves quality of life, reduces burden and disability, decreases violence and recidivism, and also reduces the misuse of drugs, especially the medication. That means many a time patients overdose these antipsychotics. Further, it also has an important role to play in public health expenditure and use of resources. What are the disadvantages of long-acting injectables? Invariably, many of the rights activists say coercion in giving injection, loss of autonomy by the patient, pain at the site of injection, EPS, tardive dyskinesia, and tremors. Use of higher dose of anticholinergic drugs is well noted in first generation long-acting injectables. To receive these injections, they need to visit hospital or nursing professionals. To conclude, my dear friends, one of the primary advantage of long-acting injectable is to improve medication adherence and compliance. Long-acting injectables reduces relapse, readmission, number of days spent in inpatient, and cost effectiveness. That means it has an important role to play in public health expenditure. Long-acting injectables were similar to oral antipsychotics in terms of effectiveness. However, they differed in side effects. First generation antipsychotics were similar to second generation antipsychotic depot preparation in terms of effectiveness. Again, they differed in side effect profile and need for anticholinergic medications. The choice of long-acting medication is based upon individual patient factors, including the nature and severity of psychiatric condition, patient's consent to take injection, and also the response to treatment. Further, the patient also need to have capacity to consent for injectables. You can give injectables only involuntarily if the patient has lost capacity, or else if there is a community treatment order and the law clearly says if the patient refuses to take medications, injectables can be given in the community. Long-acting injectables do have side effects. Hence, regular follow-up of appointment and monitoring the side effect is essential. Long-acting injectable does have an essential role in public health through decreasing the relapse, improving quality of life, disability, and burden, and indirectly decreases the healthcare expenses. This is all about long-acting injectables, my dear friends. Thank you very much for giving your valuable time. Stay safe.